patients. Shh. That's about close to 5. So, I did a lot of full body exams, some biopsies, frozen precancers, treated some illness. No acne today. Actually, I like acne. I did have a template to do, visit. Just logging into my system here. Actually, still finalizing my notes from today. Got a lot of catching up to do. It's a great field, but it's a grind every single day, Monday to Friday. And, but the good thing about dermatology, though, I'm gonna get contingent. Quality of life is great. I'm never on call. But sometimes, like right now, I have some messages that needs attention. So I gotta make sure those patients are taken. I myself is also a patient, so I can empathize because if I request a medication in order from a provider or a doctor, I would hate to keep waiting and waiting. So that's what I'm doing right now is checking for patient messages that needs attention. Okay, alright. So, hold on. Take care of something real quick. My apologies. Oh, sure, right away. Hope you're doing well. Hopefully you're not too busy. Hopefully your work is not stressing you too much. Excuse me, my apologies. Sorry. I feel rude because I want to talk to you and listen and pay attention to you. But this is one of those things that actually followed me at home. But of course, I don't want to stay at work and take care of these stuff. I got things to do at home, like family. So, sorry, give me a little second here. There you go. Alright. I am almost done. But we still have to find my chart. So, yeah, but it's nothing. It's nothing super difficult. Okay, it's one down. Hold on. Sorry for keep you waiting. I'm awful about this. My apologies. But it's one of those things. You gotta do what you gotta do to survive and take care family, and it is my responsibility to make sure things are taken care of at home. So yeah. All right. It's a it's a it's a message that I cannot ignore until tomorrow. So I gotta make sure this is taken. See the way I approach things is always empathize, always do my best to put myself in shoes. I don't know about other providers, but I can't just ignore a patient. So I have to make sure it's taken care of. And I think, in my opinion, it should be that way for everybody. Yeah. But yeah, so that's done. Let me just reply. Okay. All right. I'm good. Just if I need to finalize some charts today. Yeah, but when I finalize charts is when I close the chart permanently, and it can't be changed after a certain. So what I do is I scan through the charts for accuracy. When we send a claim to insurance company, when we claim something, for example, like Medicare, they might say, well, we need an actual office visit. So we have to be ready to come up with that stating what we're claiming is actually on the chart. Now, if we send something and it's on the chart, then of course Medicare will decline the claim. So as a provider, we want to make sure not only we take care of our patients, but also we also need to make sure is accurate and as detailed as possible. So yeah, the reality is, or I'm not sure it works through, but patient care does not stop by just seeing patient literally, it doesn't even stop at all. It's a cycle. It's a cycle. Because you can't just not follow up with patients. You have to have a constant monitoring with patients. Especially, I would say, especially dermatology is the only field of. I don't know what other specialties, but in dermatology, regardless if it's Sorry, I'm gonna do the team. Just want to make sure it's properly documented. So the way it works right now, as far as chart wise, is I have an assistant that documents for me, and sometimes the assistant doesn't. Sometimes it's not always 100% accurate. So that's what I'm doing right now. Is I'm checking if the work is accurate. So I just corrected some of the charts here to make sure it's properly documented. So let me just get one more time. Good. Alright, that's good. Forgot what I was gonna say. When it comes to we have to document as accurate as possible. But in dermatology, the difference between other field in dermatology is we document objectively of what we see and feel versus other special. They listen to stethoscopes. They look at with ear or nose to check for like electors, like so they check internally. Okay, I think I'm done. Let me just finalize this. Let me just log out here. Okay. Anyways, thank you for listening, and even for a short. I appreciate you with me, and listening. I truly, really, really, really appreciate. Well, gotta go. Hope things are well.